The Ionia R Whipper Home Incorporated facilities provide comprehensive residential programs for abused, abandoned, and neglected girls between the ages of 12 and 21 years of age. The history, tradition, and overall mission of the home go back 75 years to its visionary founder, Ionia Rollin Whipper. Truly a legendary person of color in Washington and across America, Dr. Ionia Rollin Whipper was part of a family with a legacy of achievements dating back to their Caribbean roots. She was a descendant of the Rollin family, who were among Charleston, South Carolina's elite families of color. The Rollins descended from emigres from Santo Domingo, Haiti, and were noted for their refinement and culture. During Dr. Whipper's lifetime, she gained distinction as a leader in health services to Washington's women, especially unwed mothers. In her book, Pride of Family, Dr. Whipper's great-niece, Carol Ione, starts with an African poem saluting her family and definitely her great-aunt. Those who are dead are never gone. They are there in the thickening shadow. At the Whipper home, we don't believe Dr. Whipper is really gone because her legacy is still setting standards for care and compassion for young girls. Dr. Whipper graduated from Howard University Medical School in 1903. Her medical experience in obstetrics and as a caregiver in the maternity ward of Freedmen's Hospital led her to a compassionate outreach to unwed mothers and neglected young mothers. She started an organized care program for young mothers in need at her office at 511 Florida Avenue Northwest. Through consultation with 7 men and women, they formed the Lend a Hand Club. This outreach was formalized as the Ionia R Whipper Home for Unwed Mothers, which served as the only maternity home for African American women in Washington, D.C. until well into the 1960s.
So there was a kind of pride in among the women who were there, and a good feeling to be there. It felt like it certainly was a privilege to be there and to be taken care of by Sistoni. And I recall we had a garden, and there were ducks and chickens and things out back, and so they were in a very beautiful rural environment that was comforting to them.
The Whipper home of today is a contemporary symbol of Dr. Whipper's achievements. During her years as a practicing physician, Dr. Whipper's personal concern for her fellow man earned her national acclaim for her efforts to improve health standards for Black women.
She was happy that they had realized, that the government had realized that the babies were dying too soon because of ignorance, and she was out there to fix that. She did many other things besides teaching them how the babies, how to deliver the baby, and how to take care of him, what drops were supposed to be put in the eyes. And she held classes after she got them organized, and it was quite a little while to get them organized. Then when she did that, she went from there.
Dr. Whipper moved the facility to 2000 Channing Street Northeast in 1951. In 1978, it became a shelter for abused girls between the ages of 12 and 21.
When I came on board in 1979, the change in society's views of what a pregnant young woman would have to endure to acceptance by the community and by her family had greatly changed. We began looking at the needs in the metropolitan area, and we began to see an increase in child abuse and neglect. We built our program based on the holistic approach. Number one, a young woman needs to be educated. So we opened up our schoolhouse, and it was built in 1951. We had 2 visiting teachers from DC Public Schools who taught the young women reading and writing and arithmetic.
People moved by the plight of abused and abandoned adolescent girls created the Whipper Home 75 years ago. Caring friends in the Lend a Hand Club helped Dr. Whipper make the home a reality in 1931. Through the years, the Whipper Home provided not only primary medical care for mothers and infants, but also extensive social services, education, and vocational support as well.
When I was lucky enough to find and locate the Ionia Whipper Home, which has been in existence nearly 3/4 of a century. So it was set up by someone with the best intentions, the person who started the home. It was set up to help children that were struggling with issues within our community. The staff in the home had been there for decades and were committed to the work, committed to the children, and committed to helping their staff help the children that came into the home. So I found it to have more structure, more stability, more experience, and I felt that it really went out of their way to try to reach children that were going through horrendous situations in life.
Who would the miseries of man foreknow? Apparently, in her life, Dr. Whipper foreknew. However, she passed in 1953. Her caring and forethought continues at Ionia R Whipper Home Incorporated. In the tradition of excellence, the Whipper Home continues to meet and ameliorate the miseries of our society, serving traumatized and abandoned girls.
The uniqueness of it is that even though it's a home, you've got all these under this umbrella of regulations that you must comply with, and but it still is a home. It still is their home, and you give them all the incentives, all the acknowledgments. They get the discipline, they get the rewards, they get the love, they get the nurturance, they get everything that a young person needs to survive. And if they don't have that, then it's not a home.
In 75 years of service, the Ionia R Whipper Home has provided exemplary service and needed care to abused, abandoned, and neglected girls in Washington.